Hello, my name is Tanisha Del Valle. I am a BSN student at Stanford University, and I am going to be giving a presentation on anemia. So, anemia. This is a condition characterized by a deficiency in red blood cells, also known as RBCs. Excuse me. It primarily affects the cardiovascular system and oxygen-demanding tissues like the heart, the lungs, and the overall musculoskeletal of the body. It leads to fatigue, shortness of breath, and possibly organ damage if left untreated. Anemia affects most of the body since blood vessels are everywhere. So if it's in your arms, it's in your legs, it's in your everywhere. Everywhere where you have blood. So this is what anemia looks like. As you can see, there is less RBCs in this picture, and you can see in the vessels, or this is probably a vein, how there's not a lot, whereas to the normal one, there's a little bit more of abundance. So the physiology of this disease is its formed elements of the blood include erythrocytes or red blood cells and leukocytes or white blood cells. So normally a cubic millimeter of blood contains 5.1 million to 5.8 million erythrocytes, whereas the volume for leukocytes is 5,000 to 9,000. So it's a pretty big difference there. Erythrocytes actually have an increased surface area, so they're circles, but they're flat on top to increase the amount of oxygen that they can diffuse and just for facilitated gas diffusion. Each erythrocyte contains approximately 280 million hemoglobin molecules, which give the blood its red color. Hemoglobins help carry oxygen in the blood, so each hemoglobin is made up of four protein chains, which is attached to a heme molecule, which contains iron. The iron in heme binds to oxygen in the lungs and releases it into the tissues. So again, a picture of anemia. You can see the white blood cells, the leukocytes, and the RBCs. But there is a lot more in the normal side than the anemia, as you can see here. Okay, so heme iron is recycled from old RBCs in the bone marrow. So when blood cells get old, the liver and spleen recycle the iron from the heme. They recycle from them. The recycled iron is transported through the blood by a protein called transferrin to the bone marrow, where new blood cells are made. So most of the body's iron needs are met by this recycling process, but a small amount must come from the diet. So this is when iron from food is absorbed and in the small intestine. So that is also carried by transferrin to the bone marrow and the liver. So the bone marrow makes about 200 billion red blood cells every day. So each red blood cell contains about 2 to 3 grams of iron. So we only need a small amount of iron from our diet. So, however, if iron is not in our diet and our bone marrow cannot produce enough hemoglobin, then that's when it leads to iron deficiency anemia. So this can also happen with the lack of B12, which requires a stomach substance called intrinsic factor, which is for absorption. So yeah, transferrin is bound to iron, which is taken out of the blood by the bone marrow and liver cells by endocytosis, and is triggered by transferrin to its membrane receptors. Okay, so iron deficiency anemia. That is the most common form, which is classified by the low RBCs, the hemoglobin concentration, which can result in insufficient production of normal amounts of hemoglobin, and pernicious anemia, which is commonly caused by a lack of intrinsic factor. which is required for the hemoglobin production for the digestive tract. So this results from autoimmune immune attacks of the gastric epithelium, and it's caused by intestinal malabsorption of B12 or inadequate intake. So again, iron deficiency, they may result from blood loss, from heavy menstruation or other sources of bleeding. So, and the inability to absorb iron may cause this as well. In pernicious, it's caused by intestinal malabsorption of B12 or inadequate intake of B12. Again, these are some symptoms of what we can find, of what we can see with anemia. So, with the central system, you would see fatigue, dizziness, or possibly even fainting in the most severe cases. In the blood vessels, you would see a low blood pressure, palpitations, heart rate, chest pain, angina, and even a heart attack. The heart pumps faster to make up for the low oxygen, which can lead to a fast heartbeat or heart failure if anemia is severe. Blood vessels also widen, and that's why blood pressure may drop. Respiratory system, the lungs breathing increases to try to get more oxygen, causing shortness of breath. So, yeah, just lots of different things that can happen here. So, respiratory, again, shortness of breath, the skin, pale, coldness, yellowing, and intestinal. The stool may change color, so it might turn into like a brown constipation looking color, like it's been sitting there for a while. With skin and hair, again, your hair may become brittle and may fall out. Another and something else that is seen is aplastic anemia, which is produced by damage to the bone marrow, which is serious but treatable. It's commonly caused by chemotherapy and radiation for cancer, and it's caused by exposure to toxins. So you can see this is the bone marrow. Oh my goodness, sorry. Bone marrow with normal blood cells, and with the aplastic anemia, you can see that it's a lot less. So, how are you diagnosed with this? It's mainly through physical exams, medical history, and laboratory tests. So, a physical exam will include checking your skin, evaluating your heart rate, or even doing an ultrasound of the spleen or the liver to see if it is enlarged. Blood tests that are followed are the CBC, which is a complete blood count, which measures the RBCs and the hemoglobin levels, and also the hematocrit, which is the percentage of the RBC. The reticular count is what measures number of immature red blood cells. So this helps determine if bone marrow is producing enough red blood cells. Iron studies tests measure iron on blood, including ferritin and transferrin. And vitamin B12 folate tests measure B12 and folate levels. Peripheral blood smear, a sample of blood, examined under a microscope. So again, helps identify specific types of anemia. And with the treatment, iron supplements are probably your best go-to. You can either do orally or intravenously. I have actually done intravenously. It makes a big difference in your RBCs because I am very severely anemic. Side effects like constipation and nausea and darker stool colors can definitely occur due to the irritation of the GI tract. Vitamin B12 and folate supplements are also seen to bypass the need for the intrinsic factor. Surgery may also be done for bone marrow or stem cell transplants which are needed for chronic anemia. And dietary changes may be advised to increase intake of iron-rich foods like spinach, red meat, and lentils. So again, vitamin C rich foods is recommended to improve iron absorptions. So any AI models or treatment planning, there's a platform that uses AI to analyze medical data, help diagnosis, and overall just suggest treatment plans, and that can help but with the medical images, lab results, and patient histories to help identify anemia and its cause. Another one is the anemia control model, which is currently in use in clinics outside of the US, which applies advanced AI technology to optimize anemia management in people with kidney disease and address challenges with e- erythropoietin and iron therapies. Again, another AI model. NIADA is a SAMD, a software as a medical device. It's built upon a framework of integrated solutions for anemia, screening, monitoring, and intervention. So, iron deficiency with anemia is often treatable with iron supplements and dietary changes. Pernicious anemia is a lifelong condition, typically, but may be managed with B12 injections and oral supplements. Aplastic anemia is the one that requires lifelong management and may include bone marrow transplants and depending on the severity. So again, who's most likely to develop anemia? Children under 5 years of age due to dietary insufficiencies, according to the WHO 2025. Women of reproductive age, women who are going through menstruation and have very uh stressful periods and they bleed a lot, then that's obviously going to cause anemia. So again, pregnant women, fetuses receive the increased iron requirement. So as you're growing your fetus, you're sending him all of the iron that you pretty much need. So what you take in, you have to take double because you're getting some taken out. Older adults also have a prevalence in getting anemia, and individuals with chronic diseases like Crohn's and celiac disease, which are kidney diseases. In 2021, West Saharan Africa was at 47% for anemia, South Asia coming in second at 35%, and Central Africa being at 35.7%. And the regions with the lowest anemia would be Australia, Western Europe, and the North America, all ranging between 5 and 6%. So the survival rate for anemia depends largely on the type, the severity, and the underlying cause. So severe anemia, if left untreated, can be life-threatening. However, milder forms of anemia are typically manageable with appropriate treatment. Thank you.